In my role, I've got a specific focus on supporting health and care settings to understand and address stigma. Often that means tackling the stigma that patients or service users can face in healthcare settings, but it can also mean the stigma that staff can experience in these settings when they've got a mental health problem at work. So today we're going to focus in on those kind of staff experiences of mental health stigma, how this affects staff well-being, and what we can do about it. So, CME defines mental health stigma as any negative attitudes or beliefs that are based on a preconception, a misunderstanding, or a fear of mental health. So, back in April 2021, we did some research with about 1,000 Scottish workers, asking them about their experiences of mental health stigma in the workplace. And what we found was that almost half of workers were experiencing a mental health problem at the time, but over a third of these workers, they wouldn't disclose their mental health problem at work because they were afraid of either being discriminated against by their colleagues or because they were afraid of losing their job. About a fifth as well felt that they needed to take time off work for their mental health, but they felt unable to take this time or unable to ask for it. And only a quarter of organisations were encouraging staff to talk openly about their mental health problems at work. And this is data from just a few years ago, and it shows stigma is really a very real and very much still present barrier to people being open about their well-being and about their mental health at work. And ultimately, it's still getting in the way of people getting the support that they need. So to add to that as well, last year CME published the findings from our Scottish mental illness stigma study, and this was a kind of first of its kind piece of research in Scotland where we explored how people with experience of severe mental illness face stigma across all sorts of different areas of their life. And workplaces came out as a place where people really experience stigma very often, and also a place where stigma had a massive impact on them and in their well-being across their whole life. So here are some of the findings. I won't go through everything, but I'm just going to read that quote in the bottom left-hand corner because I think it really sums up what we're trying to tackle. So one person told us that my manager has been very judgmental of one of our sales assistants' mental health struggles. And as a result, I haven't told anybody about my specific diagnosis or symptoms. So when people have experienced stigma and discrimination at work, whether that's directly themselves or through witnessing how a colleague has been treated, they do remember how that feels. And what this study told us is those experiences, they translate into like really high levels of anticipation. People expect that if they have a problem again, or if they've seen somebody else have a problem and be treated negatively, if they then have that experience of mental ill health, they're also going to be treated negatively. And what this leads to is people withdrawing from the workplace. So 85% of the people who spoke to us, they've stopped themselves applying for jobs because of mental health stigma. 75% have stopped themselves being open about their mental health at work. 45%, so almost half of the people that spoke to us, have resigned from their jobs or they've left the workplace before they were ready to do so because of mental health stigma. And 64% stopped themselves asking for flexible working or some other sort of reasonable adjustments. So overall, people experiencing and witnessing stigma and discrimination, they're less likely to apply for jobs, less likely to apply for promotions, less likely to speak up and ask for help when they need it, and more likely to leave employment prematurely. So we know mental health stigma is prevalent. We know it really impacts on staff well-being. But why do we really need to focus on addressing stigma when, well, there are so many other competing challenges and competing fires to fight in health and care organisations? Right. Well, poor mental health is costly. It costs UK employers about 56 billion or so per year. And presenteeism as well for mental ill health. That costs the UK economy about 15 billion per year. And that's actually almost twice the cost of actual absence from work. So really, really costly. And stigma is a big factor across all of this. So stigma leads to higher rates of long-term sickness absence in employees because, well, when people are reluctant to speak up and ask for support at the first signs that they're struggling, they're then more likely to go longer before they access help. They become more unwell in that time and can take a lot longer to recover and get back to work. Stigma also gets in the way of retaining staff. A big finding for us was that often employees feel it's the easier option to just leave the workplace rather than to disclose a mental health condition. And also, importantly, for the care sector as well, stigma can impact on somebody's quality of work. So, in care, that could be the quality of care that's provided to a patient or a service user. Then people are pushing themselves really to continue working when what they really need to be doing is taking some of that time off to rest and recover and get better. So often we get employers coming to us and they're doing absolutely great work on staff well-being and on staff mental health and putting all of these well-being interventions in place, but they're struggling to understand why their colleagues aren't engaging with this and why these supports aren't being very useful. Honestly, the answer often comes back to the same thing, and that's that tackling stigma and discrimination, it's absolutely foundational to any action to improve mental health. So you can have all of the helplines, all of the counseling sessions, all of the mental health first aiders in the world, but if stigma is still present and people feel like they can't talk about their mental health, they can't ask for help, then those efforts are likely to be a lot less effective. So I want to just take a minute and share a very short video that was recorded by one of our volunteers, Chick, and he's talking about his experiences of stigma in the workplace, and what we can do to address it. So I am actually gonna stop sharing and start sharing again, if that's okay. Oh,
My name is Chick Duncan, and I'm a media volunteer with CME. I have a severely debilitating mental health condition, which, according to the World Health Organization, is up there in the top 10. My condition is obsessive compulsive disorder. And in my case, it does involve a lot of washing and cleaning and avoiding touching things. Other people can have other sorts of ideas, intrusive thoughts, this sort of thing. It can impact very suddenly, so that I might drop something on the floor and then not be able to pick it up because it's not clean. And that can be very awkward in an employment situation. Somebody else might drop something on the floor and then want me to sign it, for example. Those kind of situations in a formal employment situation can be very difficult. I visited Burness Paul, a legal organisation here in Glasgow, and they were looking for somebody to come in and talk about lived experience. So I went in there, spent, I don't know, maybe an hour or so, just talking about my own life, the background and so on, how my mental health has affected what I've done and what I've not been able to do. But the other side of that coin is that I have worked part-time as an IT tutor at Glasgow University, an IT tutor in community education. I've been a web designer. Employers in particular who have to make those decisions about who you're going to employ and how you're going to employ them, try and find out a wee bit about what the condition is, what it involves, and what it doesn't involve. They'll get rid of the myths about it. Other staff, I suppose you're just hoping for people to be compassionate, and considerate if you're struggling a wee bit, to support you or even just leave you alone if that's what's necessary. So, for example, you might have someone who would benefit from flexible working, or somebody who would benefit from job share, or somebody who would benefit from being able to just phone in and say, look, I'm not too good today. Can I just work from home? I've got my laptop set up or whatever. As soon as you know that that's there, you know you're being supported. And that confidence, if you like, that people are supporting you and so that's crucial. If you don't see past the stigma, you never know what you're missing. You could be missing a potential employee of the year. You could be missing somebody who could save your company thousands or even more. See past the stigma. You don't know, in terms of the potential of the person, B, in the productivity potential, and also in terms of the financial potential that this person might bring to your company.
Okay, so Chick, I know, is talking about quite a different sector, and I know that not everything that he said will translate to the care sector. So some things like working from home might be a bit more challenging in the care sector. But the key message is still the same. It's about listening to the person, working with them to understand their condition, and together finding solutions that work for both the employee and the employer. And you're not alone in this. There is loads of information and support out there to help you tackle stigma across organizations. There's actually a whole field of research that's dedicated to finding ways to tackle mental health stigma in work. And at CMU, we've worked quite hard to combine this research and bring it together with our own knowledge after years of working with employers across Scotland and surveying thousands of employees at all different sorts of levels of organisations. And we've put this into 7 key building blocks for creating stigma-free workplaces. And we've used these to develop our See Me and Work program. This is a whole program of kind of tools and resources that allow employers in Scotland to fairly easily apply what we know works. I won't go into all of them just now, but you can find more information on our website along with lots of kind of helpful videos and things to get to grips with this. And it is really important to take a whole organizational approach and go through these building blocks. But I know that can feel like quite a big piece of work for a lot of organizations, especially if you're pressured in other areas. So let's also just look at some resources that might help. So for those of you that get how important stigma is to tackling mental health stigma, and supporting staff well-being, but maybe you're struggling to make the case to senior leaders in the organization, we've got some kind of specific tools and resources that might help you do this. So there will be links on the slides, which I'm happy to share afterwards. But there's a brief that sets out the legal, moral, and business case for tackling stigma. There's also the UK Government Thriving at Work report, and that sort of breaks down the financial cost of poor mental health at work. So really, really useful. We've got a cost calculator that does that as well. And there's a few briefs and videos and things and tools about our See Me and Work program, which is totally free, by the way. And yeah, can be really useful for an organization to take on to kind of make those steps towards tackling stigma at work. These are also some of our most requested resources. So we've got a set of e-learning modules on how to reduce stigma in the workplace. We've also got our Let's Chat tool, which provides guidance for managers to talk to their employees about mental health. Got a Spotlight On series and case studies, and also some campaigns that you can take part in. And these campaigns, they can be a really great starting point as well if you're just kind of looking to dip your toes into kind of tackling stigma at work as a first point. So we've got coming up on the 1st of February, Time to Talk Day 2024. And that's a national day of conversation about mental health stigma. And you can do kind of whatever you want really for that, but we've got lots of activity packs if you want to kind of have coffee mornings and other kind of little activities at work as